Question 1. A 68-year-old male is found unresponsive, pulseless, and apneic. CPR is immediately initiated. What is the most appropriate next intervention after confirming pulselessness and beginning chest compressions? A. Establish an advanced airway. B. Administer 2 ventilations via bag valve mask. C. Apply an automated external defibrillator, AED. D. Administer 1 mg of epinephrine intravenously. Answer: C. Apply an automated external defibrillator, AED. This question tests your understanding of the immediate priorities in cardiac arrest management, and the keyword most appropriate next intervention after starting CPR is crucial. Early defibrillation is the single most important intervention for improving survival from sudden cardiac arrest caused by ventricular fibrillation or pulseless ventricular tachycardia. While airway management and ventilations are vital, rapid application and analysis by an AED can deliver a life-saving shock that could restore a perfusing rhythm. For example, if the patient is in a shockable rhythm, delaying defibrillation significantly reduces their chances of survival. Remember, shock first is often the mantra for witnessed cardiac arrest if an AED is immediately available. Question 2. When assessing a patient with a suspected spinal injury, what is the primary reason for applying a cervical collar? A. To prevent the patient from moving their head. B. To reduce pain and discomfort for the patient. C. To stabilize the head and neck to minimize movement of the cervical spine. D. To facilitate easier intubation if the patient's condition deteriorates. Answer: C. To stabilize the head and neck to minimize movement of the cervical spine. This question focuses on the core purpose of cervical collar application in spinal trauma, with primary reason being the key phrase. The main goal of a cervical collar is to restrict motion in the neck, specifically the cervical spine, to prevent further injury to the spinal cord. While it might reduce pain or prevent head movement, these are secondary benefits to the critical task of maintaining spinal immobilization. For instance, if a patient has an unstable fracture, preventing even slight movement can be life-saving. Always remember that cervical collars are part of a broader spinal immobilization strategy, aiming to keep the spine as still as possible during transport. Question 3. A 24-year-old female presents with severe difficulty breathing, hives, and facial swelling after eating peanuts. Her blood pressure is 80/40 mmHg. What is the most appropriate initial medication administration, if allowed by protocol? A. Albuterol via nebulizer. B. Epinephrine 1:1000 intramuscularly. C. Diphenhydramine intravenously. D. Dexamethasone orally. Answer: B. Epinephrine 1:1000 intramuscularly. This scenario describes anaphylaxis, a life-threatening allergic reaction, and the keywords severe difficulty breathing, hives, facial swelling, and blood pressure 80/40 mm of mercury, indicating hypoperfusion/shock, point directly to its severity. Epinephrine is the definitive first-line treatment for anaphylaxis because it addresses both the bronchoconstriction and vasodilation, improving breathing and blood pressure. Administering epinephrine quickly can reverse the life-threatening effects. For example, if a patient is experiencing airway swelling and low blood pressure due to anaphylaxis, epinephrine acts rapidly to open the airway and constrict vessels. Always prioritize epinephrine administration in severe allergic reactions. It's the critical intervention that can halt the progression of shock. Question 4. What is the recommended compression to ventilation ratio for a single rescuer performing CPR on an adult? A. 15 compressions to 2 ventilations. B. 30 compressions to 2 ventilations. C. 30 compressions to 5 ventilations. D. 5 compressions to 1 ventilation. Answer: B. 30 compressions to 2 ventilations. This question tests a fundamental component of adult basic life support, BLS, protocols, the compression to ventilation ratio for a single rescuer. The standard ratio for adult CPR, whether performed by 1 or 2 rescuers, is 30 compressions followed by 2 ventilations. This ratio aims to maximize chest compression fraction while still providing necessary oxygenation. For example, after 30 rapid, deep compressions, the rescuer pauses briefly to deliver 2 breaths, then immediately resumes compressions. Mastering this ratio is key to effective CPR, ensuring consistent blood flow to vital organs. Question 5. You are assessing a conscious 5-year-old child who fell from a swing set. The child is crying and complaining of left arm pain. On inspection, you note an obvious deformity to the forearm. What is your priority action in managing this injury? A. Apply a cold pack to the injury site. B. Administer oral pain medication. C. Manually stabilize the injured extremity. D. Elevate the arm above the level of the heart. Answer: C. Manually stabilize the injured extremity. This question evaluates your immediate priorities in managing a suspected musculoskeletal injury in a pediatric patient, with priority action being the crucial directive. Manual stabilization of a deformed extremity is paramount to prevent further injury to surrounding tissues, nerves, or blood vessels before applying a splint. While pain management, cold packs, or elevation might follow, they are secondary to ensuring the limb is not moved unnecessarily. For instance, if the forearm has a displaced fracture, movement could damage nerves or cause an open wound. Always remember that preventing further injury through stabilization is the first critical step in managing orthopedic trauma. Question 6. A patient with a history of emphysema is experiencing increased shortness of breath and wheezing. Their SpO2 is 88%. What is the most appropriate initial oxygen delivery device for this patient? A. Nasal cannula at 2 to 4 liters per minute. B. Non-rebreather mask at 15 liters per minute. C. Simple face mask at 6 to 10 liters per minute. D. Bag valve mask with supplemental oxygen. Answer: A. Nasal cannula at 2 to 4 liters per minute. This question assesses your understanding of oxygen administration for patients with chronic obstructive pulmonary disease, COPD, specifically emphysema, and the phrase "most appropriate initial oxygen delivery device" is key. While hypoxia needs to be corrected, patients with COPD may rely on a hypoxic drive to breathe, so high-flow oxygen can suppress their respiratory effort. A nasal cannula at a low flow rate, 2 to 4 liters per minute, is generally the preferred initial approach to gently increase SpO2 without over-oxygenating. For example, providing 15 liters per minute via a non-rebreather to a patient with chronic CO2 retention could lead to respiratory depression. The goal is to provide just enough oxygen to improve their SpO2 to an acceptable range, example 90 to 94%, while monitoring their respiratory status closely. Question 7. What is the primary purpose of the primary assessment in emergency medical care? A. To obtain a detailed medical history from the patient. B. To identify and treat immediate life threats. C. To conduct a head-to-toe physical examination. D. To determine the patient's chief complaint. Answer: B. To identify and treat immediate life threats. This question is about the core objective of the primary assessment, and primary purpose is the key phrase. The primary assessment is a rapid, systematic evaluation designed to identify and address any life-threatening conditions related to the patient's airway, breathing, circulation, disability, and exposure, ABCs. While a chief complaint is gathered and a detailed history and physical exam follow, these are part of or subsequent to the primary assessment. For example, if a patient is unresponsive and not breathing, the primary assessment dictates immediate intervention to open the airway and assist ventilations. Always remember that the primary assessment is focused on immediate survival and rapid intervention. Question 8. A 35-year-old male is bleeding profusely from a laceration on his forearm. Direct pressure with a sterile dressing has been applied, but the bleeding continues. What is the most appropriate next step to control the hemorrhage? A. Apply a tourniquet proximal to the wound. B. Elevate the injured extremity above the heart. C. Apply indirect pressure to a proximal pressure point. D. Apply a hemostatic dressing to the wound. Answer: D. Apply a hemostatic dressing to the wound. This question tests the management of severe external hemorrhage, with the keyword most appropriate next step after direct pressure has failed. While tourniquets are effective for extremity hemorrhage, current guidelines suggest applying a hemostatic dressing directly into the wound with continued direct pressure as the next step for significant external bleeding not controlled by direct pressure alone, especially on the trunk or junctional areas where a tourniquet cannot be applied. For example, if a deep laceration on the forearm continues to bleed despite pressure, packing it with a hemostatic dressing can promote clotting. Remember, direct pressure is always first, but if insufficient, specialized dressings can be incredibly effective before resorting to a tourniquet, if available and appropriate for the wound location. Question 9. A patient is found unconscious with pinpoint pupils, shallow respirations at 6 breaths per minute, and a history of opioid abuse. What medication would an EMT most likely administer per protocol? A. Activated charcoal. B. Aspirin. C. Oral glucose. D. Naloxone. Answer: D. Naloxone. This scenario describes a classic presentation of opioid overdose, with unconscious, pinpoint pupils, shallow respirations at 6 breaths per minute, and history of opioid abuse being critical clues. Naloxone is an opioid antagonist specifically used to reverse the effects of opioid overdose by blocking opioid receptors in the brain, rapidly improving respiratory depression. For example, administering naloxone to such a patient can cause them to suddenly resume normal breathing and regain consciousness. Recognizing the signs of opioid overdose and promptly administering naloxone is a life-saving intervention. Question 10. You arrive on scene to a motor vehicle collision. The patient is entrapped, and gasoline is leaking from the vehicle. What is your priority action as an EMT? A. Begin immediate patient assessment and treatment. B. Request fire department for extrication and hazard control. C. Establish a landing zone for air medical transport. D. Secure the scene with flares and reflective cones. Answer: B. Request fire department for extrication and hazard control. This question emphasizes the critical importance of scene safety before patient care, and the keywords entrapped and gasoline is leaking clearly indicate a hazardous situation. Ensuring scene safety is always the first priority in any emergency, especially those involving potential hazards like fuel spills or entrapment. Initiating patient care or setting up transport without addressing the hazard puts both the patient and rescuers at extreme risk. For example, approaching a vehicle with a fuel leak could lead to an explosion or fire. Always ensure the scene is safe, or rendered safe by appropriate resources like the fire department, before proceeding with patient contact. Question 11. During assessment of a 72-year-old patient, you notice unequal pupils. What might this finding suggest? A. Hypoglycemia. B. Spinal cord injury. C. Increased intracranial pressure. D. Anaphylactic reaction. Answer: C. Increased intracranial pressure. This question tests your knowledge of neurological assessment findings, specifically the significance of unequal pupils. Unequal pupils, anisocoria, particularly if one pupil is dilated and sluggishly reactive or fixed, can be a significant sign of increased intracranial pressure, ICP, due to conditions like a brain bleed or swelling. While other conditions can cause unequal pupils, in an emergency setting, especially with trauma or altered mental status, ICP is a critical consideration. For example, a patient with a head injury might develop a hematoma causing pressure on the oculomotor nerve, resulting in pupillary changes. This finding warrants immediate concern and rapid transport. Question 12. A 3-year-old child presents with a sudden onset of barking cough, stridor, and respiratory distress. The child has no fever. What is the most likely cause of these symptoms? A. Epiglottitis. B. Croup. C. Bronchiolitis. D. Asthma exacerbation. Answer: B. Croup. This question describes the classic presentation of croup, with 3-year-old child, sudden onset, barking cough, stridor, and no fever being key differentiating features. Croup is a viral infection that causes swelling around the vocal cords, trachea, and bronchi, leading to the characteristic seal bark cough and inspiratory stridor. Epiglottitis typically presents with high fever, drooling, and difficulty swallowing. Recognizing these distinct pediatric respiratory conditions is vital for appropriate management. For example, a child with croup often benefits from humidified oxygen, whereas epiglottitis is a true airway emergency. Question 13. What is the primary purpose of positive pressure ventilation, PPV, when assisting a patient's breathing? A. To deliver precise amounts of medication. B. To overcome airway obstruction caused by foreign bodies. C. To force air into the lungs when a patient's own respiratory efforts are inadequate. D. To inflate the stomach, aiding in gastric decompression. Answer: C. To force air into the lungs when a patient's own respiratory efforts are inadequate. This question addresses the fundamental purpose of positive pressure ventilation, and primary purpose is the key phrase. PPV, such as using a bag valve mask, is applied when a patient's own breathing is too slow, too shallow, or absent, to ensure adequate oxygenation and ventilation. It is designed to deliver breaths to the lungs by increasing pressure in the airway, overriding inadequate or absent spontaneous breathing. For example, if a patient overdoses and has shallow respirations, PPV is used to maintain oxygenation and carbon dioxide removal. Understanding that PPV supports or replaces failed natural breathing is crucial. Question 14. A patient reports crushing chest pain radiating to their left arm. They are pale, diaphoretic, and nauseated. What is the most important pre-hospital treatment to initiate for this patient, assuming protocols allow? A. Administer aspirin. B. Administer nitroglycerin. C. Administer supplemental oxygen. D. Request advanced life support, ALS. Answer: A. Administer aspirin. This scenario strongly suggests an acute coronary syndrome, such as a heart attack, with crushing chest pain radiating to their left arm, pale, diaphoretic, and nauseated being classic signs. Aspirin is the most important initial pre-hospital medication because it inhibits platelet aggregation, which can limit the growth of the clot causing the heart attack. While oxygen and nitroglycerin are often indicated, aspirin directly addresses the underlying pathological process. For instance, giving aspirin can help prevent further clot formation in the coronary artery. Always prioritize aspirin in suspected cardiac chest pain unless contraindicated. Question 15. What is the normal respiratory rate range for a healthy adult at rest? A. 6 to 10 breaths per minute. B. 8 to 14 breaths per minute. C. 12 to 20 breaths per minute. D. 20 to 30 breaths per minute. Answer: C. 12 to 20 breaths per minute. This question tests your knowledge of normal vital signs, specifically the respiratory rate in a healthy adult. A normal, resting respiratory rate for an adult is generally considered to be between 12 and 20 breaths per minute. Rates outside this range, especially if accompanied by other symptoms, can indicate respiratory distress or other medical conditions. For example, a patient breathing at 8 breaths per minute is likely hypoventilating, while one breathing at 28 breaths per minute is tachypneic. Knowing these normal ranges provides a baseline for recognizing abnormal findings. Question 16. What is the primary role of the incident commander, IC, at a mass casualty incident, MCI? A. To perform all patient care and treatment. B. To designate triage and transport officers. C. To maintain overall control and coordination of the scene. D. To gather detailed information from all witnesses. Answer: C. To maintain overall control and coordination of the scene. This question focuses on the essential function of the incident commander, IC, within the Incident Command System, ICS, at an MCI, and primary role is the keyword. The IC is responsible for the overall management of the incident, including setting objectives, ensuring safety, and coordinating all resources and personnel. While they designate other roles like triage and transport officers, their ultimate responsibility is for the entire operation. For example, in a large vehicle crash, the IC ensures that fire, EMS, and law enforcement efforts are synchronized. The IC is the single point of contact for overall decision-making and resource deployment. Question 17. A 6-month-old infant is apneic and pulseless. What is the recommended depth of chest compressions for this infant? A. Approximately 1 inch 2.5 centimeters. B. Approximately 1.5 inches 4 centimeters. C. Approximately 2 inches 5 centimeters. D. At least 2.4 inches 6 centimeters. Answer: B. Approximately 1.5 inches 4 centimeters. This question specifically asks about the correct depth of chest compressions for an infant during CPR. For infants, the recommended compression depth is approximately 1.5 inches 4 centimeters, or about 1/3 the anterior-posterior diameter of the chest. This depth is critical to achieve adequate circulation without causing injury. For example, pressing too shallow won't move enough blood, while pressing too deep risks internal organ damage. Always aim for the correct depth and rate to optimize outcomes during infant CPR. Question 18. What is the purpose of reassessing a patient's vital signs and mental status during transport? A. To gather additional medical history. B. To document changes in the patient's condition and the effectiveness of interventions. C. To confirm the initial assessment findings. D. To determine if the patient is malingering. Answer: B. To document changes in the patient's condition and the effectiveness of interventions. This question highlights the critical importance of ongoing patient reassessment, and purpose of reassessing is the key concept. Reassessment during transport is vital to monitor for improvements or deteriorations in the patient's condition and to evaluate if the treatments provided are having the desired effect. It's a continuous process that guides further interventions and provides crucial information for hospital staff. For example, if a patient with asthma improves after a nebulizer treatment, their vital signs and lung sounds should reflect this, guiding whether further treatment is needed. Regular reassessment ensures patient care remains dynamic and responsive. Question 19. A 50-year-old male with a history of diabetes is confused, has rapid, deep respirations, and a fruity odor on his breath. His blood glucose is 480 milligrams per deciliter. What is the most likely cause of his symptoms? A. Hypoglycemia. B. Diabetic ketoacidosis, DKA. C. Hyperosmolar hyperglycemic state, HHS. D. Insulin shock. Answer, B. Diabetic ketoacidosis, DKA. This scenario perfectly describes diabetic ketoacidosis, DKA, with confused, rapid, deep respirations, Kussmaul respirations, fruity odor on his breath, due to ketones, and blood glucose 480 milligrams per deciliter, hyperglycemia, being classic indicators. DKA occurs when the body produces high levels of ketones due to insufficient insulin, leading to acidosis. While HHS also involves hyperglycemia, it typically doesn't present with Kussmaul respirations or a fruity odor. For example, a patient with DKA may also complain of abdominal pain and excessive thirst. Recognizing DKA is crucial for appropriate pre-hospital management, which focuses on hydration and transport. Question 20. What is the proper technique for opening the airway of an unresponsive patient with a suspected cervical spine injury? A. Head tilt, chin lift maneuver. B. Jaw thrust maneuver. C. Oropharyngeal airway insertion. D. Nasopharyngeal airway insertion. Answer, B. Jaw thrust maneuver. This question specifically asks about airway management in the context of a suspected cervical spine injury, making suspected cervical spine injury the critical keyword. The jaw thrust maneuver is the preferred method for opening the airway in such cases because it minimizes movement of the head and neck, thereby reducing the risk of further spinal cord damage. The head tilt, chin lift maneuver is contraindicated due to its potential to exacerbate spinal injury. For example, if a patient falls from a significant height and is unconscious, a jaw thrust maneuver should be used to establish an airway. Always prioritize spinal immobilization while ensuring airway patency. Question 21. A 6-year-old child ingested an unknown amount of household cleaning product. The child is conscious but complaining of burning in their mouth and throat. What is the most appropriate immediate action? A. Induce vomiting. B. Administer activated charcoal. C. Contact poison control and transport. D. Give milk to dilute the substance. Answer, C. Contact poison control and transport. This scenario involves a suspected poisoning by a corrosive substance, and burning in their mouth and throat after ingesting a household cleaning product are key clues. The most appropriate immediate action is to contact poison control for specific guidance and begin transport to a medical facility. Inducing vomiting or administering activated charcoal is generally contraindicated for corrosive ingestions because they can cause further damage to the esophagus and airway. Giving milk may not be advised without specific instruction. For example, a caustic substance can cause severe burns as it comes back up if vomiting is induced. Always call poison control immediately for specific instructions on managing ingestions. Question 22. What is the legal concept that protects an EMT from liability when providing care in good faith and without gross negligence, usually outside of their employment? A. Battery. B. Assault. C. Abandonment. D. Good Samaritan laws. Answer: D. Good Samaritan laws. This question tests your understanding of legal protections for medical professionals assisting in emergencies, with protects an EMT from liability and in good faith and without gross negligence, usually outside of their employment, being key phrases. Good Samaritan laws are statutes enacted in most states to encourage people to provide emergency medical assistance to injured or ill persons without fear of being sued, provided they act reasonably and without gross negligence. These laws do not apply to actions performed within the scope of one's employment. For instance, if an EMT stops at the scene of a crash while off duty and renders aid, they are typically protected. Understanding these laws helps ensure you can act confidently in unexpected emergencies. Question 23. What is the most common cause of airway obstruction in an unresponsive medical patient? A. Foreign body aspiration. B. Bronchospasm. C. Swelling from an allergic reaction. D. The tongue falling back into the pharynx. Answer: D. The tongue falling back into the pharynx. This question addresses the most frequent cause of airway obstruction in an unresponsive patient, and the keyword most common cause is critical. In an unconscious patient, the muscles that control the tongue and lower jaw relax, allowing the tongue to fall back and block the upper airway. This is why airway maneuvers like the head tilt, chin lift, or jaw thrust are so crucial. While foreign bodies, bronchospasm, and allergic reactions can cause obstruction, the tongue is the most common culprit in the unresponsive medical patient. For example, simply tilting the head back can often open the airway of a patient who is snoring or making gurgling sounds. Question 24. A patient involved in a motor vehicle collision complains of severe chest pain and difficulty breathing. On assessment, you note absent lung sounds on the left side and tracheal deviation to the right. What is the most likely underlying condition? A. Simple pneumothorax. B. Hemothorax. C. Tension pneumothorax. D. Flail chest. Answer: C. Tension pneumothorax. This scenario describes a tension pneumothorax, a life-threatening condition, with severe chest pain, difficulty breathing, absent lung sounds on the left side, and critically, tracheal deviation to the right as hallmark signs. A tension pneumothorax occurs when air enters the pleural space but cannot escape, causing pressure to build and shift the mediastinum, including the trachea, to the unaffected side, compromising heart and lung function. A simple pneumothorax would not typically cause tracheal deviation. For example, this patient's condition will rapidly deteriorate without immediate intervention such as needle decompression by advanced providers. Recognizing these critical signs is vital for prompt recognition and urgent transport. Question 25. You are caring for a patient who is actively seizing. What is your priority action as an EMT? A. Restrain the patient to prevent injury. B. Insert an oral airway to protect the tongue. C. Clear the area around the patient to prevent injury. D. Administer oxygen via non-rebreather mask. Answer: C. Clear the area around the patient to prevent injury. This question focuses on the immediate priority for a patient actively experiencing a seizure, and priority action is key. Your primary concern during an active seizure is patient safety, specifically preventing injury from striking objects. Restraining the patient can cause musculoskeletal injuries, and inserting an oral airway during active clenching can damage teeth or your fingers. While oxygen may be beneficial, ensuring safety comes first. For example, if a patient is seizing on the floor, move furniture or sharp objects away from them. Your role is to protect the patient from self-harm during the seizure, not to stop it or force anything into their mouth.